What's up YouTube? It's your girl Courtney, aka Your Fan Coco. I just wanted to come and make a quick video regarding the coronavirus, also known as COVID-19. Stay tuned. Alright, so I'm not going to go into a lot of details as far as the coronavirus. We all have kind of a broad understanding of it. I can do a video on that later, but I just wanted to come and discuss a couple of things. This virus is pretty much unknown as far as how it's spread. We're learning, you know, hour by hour. We're changing protocols. The government, the president, healthcare professionals are constantly talking about this 24 hours a day. The news is pretty much groundbreaking every time. It's constantly rolling out and being cutting edge. So as we continue to, you know, carry on in our day, there will be changes, but there were some things that I'm noticing working in the healthcare profession as a nurse, and I just thought it was very important that for those that don't read the news, that aren't taking it as serious, that you should know, because a lot of these things, well, one, we should all be doing, and two, some of us use on a daily basis. So I wanted to discuss very quickly hand hygiene. I cannot stress enough how important it is to wash your hands. Washing your hands is the main way to break the chain of infection, regardless of what it is. It doesn't matter if it's airborne, if it's droplet. The main thing that we should be focusing on is hand hygiene. So hand sanitizer, it's great, perfect, but there's one thing that's better than hand sanitizer, and that's soap. Soap and water. Soap and water is going to be your best friend during this time frame. And I just wanted you guys to know that when you're washing your hands, you want to wet your hands before you're actually applying the soap first. You want to wash your hands for 20 seconds. And you want to be sure that when you're washing your hands and rinsing them, your hands are facing down. You don't want them up. You don't want it to be coming down your hands. Rinse your hands downward. That's very important and a great key. And also when you're drying your hands, you want to pat them dry. Pat them dry. Okay? You don't want to do this, all of that when you're drying it. Don't go this way. And when you're turning off the water, do not use your bare hands. If you're opening doors, leaving a public bathroom, don't use the same towel that is wet that you just dried your hands with. Get a dry one, open the door with that paper towel. It's very important. And you also want to make sure that you're washing your hands for at least 20 seconds. That's another key to this. You can sing happy birthday twice, and that will account for 20 seconds. They're also coming out with a bunch of songs that you could sing. Outkast, Miss Jackson. There was another one, Living on a Prayer by Bon Jovi, and I Will Survive by Gloria Gaynor. Those are songs that you could sing, and it takes you 20 seconds. So be mindful of that and know that that's going to be one of the biggest things as far as when it comes to chain of infection and breaking it. I also wanted to mention that if you're wearing a mask, if you have to wear one, if you're choosing to wear one, it's important to know how to put on a mask. I don't have a lot of masks or different styles of it. I have this basic surgical mask. There's going to be a metal part in the mask. You want to bend this. You want to place this over your nose, the bridge of your nose. This one goes behind my ears. You're going to put it behind your ear. Put it behind your ear. You want it to come down. I get it. It's uncomfortable to wear. You feel like you can't breathe. But you need to keep it over your nose. It's not supposed to be worn like this. Because as far as we know right now, it's droplet. The spread is droplet. Well, if somebody sneezes, you are now being exposed through the nares of your nose. So you don't want to wear it like this as much as it's uncomfortable. If you're required to wear one, wear it correctly. This is how you're going to wear it. It should come down under your chin. So be mindful of that. There's other styles, but just know it's supposed to go over the bridge of your nose, and it's supposed to cover all of this. I know that they have mentioned as far as men's facial hair. I'm not too sure as far as that, but if you do have a lot of facial hair and it's not covering your face and it's sticking out, you're not going to be protected like you should be. Cough in your elbows. Please, if you're not wearing a mask, if you sneeze, if you cough, cough in your elbows. We're dabbing right now. This is what we're doing. Hopefully I'm not ashy. Oh, I'm ashy. It's fine. So yes, cough in your elbows. You don't want to use your hands because then you're touching stuff and you're spreading germs. Please try to avoid that. I can't stress it enough. You know, I constantly have to touch keyboards and mice from the computer. I have to touch door handles and just buttons. And if we're not cognizant of what we're doing, we're creating a greater chance of this spreading. We have to be very mindful of those things. I'm hyper vigilant at this point because I'm in a healthcare setting. It can kind of be annoying as much as I'm washing my hands. My skin is very dry, so I'm trying to be mindful of applying lotion, moisturizing lotion, to help retain that moisture in my skin, because when you get breaks in your skin, you're also increasing your risk of infection. So be mindful of that too with all the hand washing, especially the hand sanitizers. Hand sanitizers are going to dry your hands out more than washing your hands with soap and water. So just make sure that you are applying lotion and moisturizing lotion after you get done washing your hands to make sure that your skin is less likely to have breaks in it. I also wanted to discuss as far as symptoms. I know that some people are asymptomatic, so that's a little difficult. So I guess, you know, they're still trying to find out ways as far as how to detect it in those that are asymptomatic. But the cardinal symptoms are cough, shortness of breath, and fever. And pretty much with my job, if you are exhibiting those symptoms, they're telling you to isolate yourself for 2 weeks. And I know that's a little crazy, but we honestly need to be practicing social isolation anyways, and social distancing. So if you feel that you have those symptoms, of course, go in, be seen. But if you aren't having any symptoms, don't take it personal or feel that what you're saying is being negated. That's not the case. They're focusing on people mainly that have symptoms. So, you know, hopefully wherever it is that you live, you can be tested. I just don't know, but I know that with my company, our focus is people that are coming in with those symptoms, that are saying they traveled in the last 14 days internationally, or that they have come in contact or potentially have come in contact with somebody that has coronavirus or could have coronavirus because they exhibit those signs. So just be mindful of that. If you do interact with people, make sure that it's not a huge crowd. I get it. We want to live. We want to do all those things and enjoy our lives. But right now is not the time. We're really trying to, you know, break this. And we won't be able to do that when we have all these large social gatherings. So you want to make sure that you're staying 6 feet away from people. If it's droplet, that's the distance that is going to be safe as far as it's spreading, and as far as how far drops can go, like when you sneeze, when you cough. So make sure that you're staying at least 6 feet away from people. That's key. So I know that people want to travel. The flights are cheap, but be mindful of those things. You know, I'm not a doctor, but I'm a nurse, and these are things that we're really enforcing and pushing in my company. And you know, hopefully we see results and we see a decline in this. We're really taking this serious. You know, if you are going to be around people, it's hit or miss as far as people saying you should wear the mask, you shouldn't wear the mask, the person that is sick should wear the mask. But if people are asymptomatic, or, you know, they have a little sniffle, a cough. I have really bad allergies, so I'll randomly start sneezing and coughing. So I let my patients know, like, hey, you know what? I have really bad allergies. I'm not sick. So, you know, you may be around somebody that starts sneezing and coughing and they're not wearing a mask. you know, protect yourself. So keep that distance. If you do decide to wear a mask, that's great. Wear it properly. You have to be proactive in your care, and being proactive in your care is also being proactive for others. You know, the elderly people, they're at a great risk. The infants, the small children are also at a great risk because their immune systems are not as strong. So you want to just be mindful not only of yourself. You may have great health. You may be doing vitamin C, eating foods that contain high levels of vitamin C. That's fantastic, but you have to think about others at this point because it's bigger than you. And I also wanted to say that, you know, with my company, every company is different. We're of course going to see patients if they want to be seen, but right now the goal is to see those that require immediate attention. So if you find yourself like, oh, I want to go for my annual physical, great. If you really feel that you want to do it, go for it. But if it's not something urgent, hold off right now. We're trying to keep these facilities almost bare bones, and we're trying to help those that can't help themselves, you know, like the elderly. When they're calling, if they don't need to come in and be seen, we're having them call us and talk to us over the phone, and that's like 60 and up, 65 and up. Where with the children, we're trying to push out those well visits right now. If they don't need anything or direct attention at this time, we're distancing those appointments further out to protect those that are still in good health. And we don't want to compromise more people than what we have to. I would just say really take awareness to what you're doing as far as, you know, moving around in your day-to-day life. Of course, you're supposed to be inside your home. I know a lot of people aren't necessarily following those things because I see it on Instagram. And I'm not the police. I can't control that, but I just really want to stress washing your hands, covering your cough, not with your hand, with your elbow. You want to make sure that if you're wearing a mask, you're wearing it properly, and you just want to take all those necessary steps. We want to minimize this issue. So you need to be proactive. You don't want to, you know, be the problem in what's going on. You want to help it. So those are ways that I felt that were very important. And I also wanted to mention one more thing. Like I said, all of this is groundbreaking. It's constantly changing. We're constantly finding out new information. And I thought it was very pertinent when I heard it today at work. And I also did just a little bit of research. Pretty much they were saying that they're not sure exactly what is causing it, but it has been noted that ibuprofen, also known as Motrin, ibuprofen is the generic name, and Motrin is the trade name. They're encouraging patients to avoid the use of that. And I also read aspirin because they are noticing that it is causing exacerbation in the symptoms of people that have coronavirus. So if you could avoid taking that pain medication right now and doing a topical, and they're encouraging the use of Tylenol, do that. And they were also saying to be mindful of nebulizers, breathing treatments, because it could potentially, with the mist coming out of the nebulizer, cause the virus to be airborne. So we're not saying don't give yourself breathing treatments, you know, that's not what we're saying, but you want to be mindful because we're not sure how this thing can spread, and we don't want it to be a greater problem than what it already is. So, you know, do your own research, talk to your doctors, reach out and ask those questions. Don't be naive. It's okay, you know, if you want to, you know, take the stance of not being afraid, but you need to be aware. There's a difference between awareness and just being oblivious. And we don't want to do that. Not in the state that we're in. Lives are being lost and they shouldn't have to be, you know. Of course, I get it, you know, it should have been prevented months ago. We're here now. We can't focus on what should have been done then. We have to focus on the here and now. So do your part, be proactive, and make sure that you're taking care of yourself so you can help take care of others indirectly. Leave your comments in the box. Thank you for watching this video. Yeah, and I'll probably will make another video. I'm not too sure when. I honestly didn't expect or plan to make this video. I was in the process of doing videos as far as nursing school, how it's going. I will be posting those, but I felt that this was cutting edge and it's very important, and my goal is to save lives and protect lives. So I just want to make sure that you guys are safe, that you guys are healthy, that you guys are well. Take this time and, you know, focus on yourself, meditate, and just being better humans. And this is going to help. This is truly going to help us all. And that's it. Thank you for listening. Thank you for watching. Take care. Bye.